I'd like to welcome you to the Learning Studio and to the first in the winter quarter colloquy series. My name is Dee Gallo. I'm the director of the Teaching, Learning, and Technology Center here at UCI. We're up on the third floor, and welcome to our Learning Studio. We co-sponsor this event with the Division of Undergraduate Education, and Dean Sharon Salinger, unfortunately, is out of town, but she extends her welcome to you all. We're particularly interested and pleased about this particular colloquy because it represents a partnership with our College of Medicine, and also because, as you are probably very aware of, the issue of teaching with technology, all the way from having a little bit of enhancement in your classroom, having your course syllabus up on a website, all the way to fully online. These are big topics of conversation right now. And this particular colloquy is on implementing a digital medical curriculum where the students are pretty much tethered to their iPads. Their content and most of their learning is all done on the iPad. And I believe UCI was the first College of Medicine to do this, right?
Correct.
Okay, so again, we're in the forefront of everything. I would like to read to you some of the qualifications of our panelists today because they really are impressive. Especially because even though they're coming from the College of Medicine, they have very close ties to undergraduate education as well. So they've got the medical curriculum, undergraduate curricular perspectives, as well as the technological perspectives. So first we have Professor Shahram Loftapour, who is a professor of clinical emergency medicine and public health, which is just on the second floor, here at UCI. He's Associate Dean for Clinical Science Education, Director of the Center for Trauma and Injury Prevention Research, and Managing Associate Editor for the Western Journal of Emergency Medicine. The UC Irvine School of Medicine clinical curriculum has been recognized for its implementation of the IMED initiative, bedside ultrasound, and its simulation education. His research focus includes alcohol screening, brief intervention, and referral to treatment using a novel handheld computerized model in the UC Irvine Emergency Department, all three trauma centers in the Orange County and UC Irvine Community Outreach Clinic as well. He also has a special interest in mentoring medical students in career advancement and medical student research. So let us welcome Professor Loftapour. And very impressive credentials. We also have Professor Warren Weekman. He currently serves as the Faculty Director of Instructional Technologies here at the UC Irvine School of Medicine. He serves as the Director, skipped here. He is the project leader for the school's IMED initiative and a comprehensive digital overhaul of the curriculum, which uses the iPad as its centerpiece for curricular innovation. His interests include integration of technology to improve clinical workflows and efficiency, instructional technology and information design to enhance education, mobile and asynchronous learning, and the development of a medical student curriculum in informatics and digital literacy. Do you people sleep? I'm wondering, as I'm reading these, I'm just so impressed. I also want to point out that Warren is sort of like anteater to the 20th power. He did his undergraduate work here. He switched from biology to digital arts, right? And then went to business school, and then went to med school here. And now, of course, is a faculty member here, so we can't get rid of him. he keeps hanging around. Julie Yum is a member of the Instructional Technologies Group at the UC Irvine School of Medicine, and her recent work is focused on implementing effective uses of the iPad in a clinical setting through the IMED initiative, and working with faculty and students to explore and integrate technology into the medical school curriculum. Her other research interests include mobile technologies, digital and blended learning, and systems thinking. Yum received her PhD in cognitive studies and education from Columbia University and also holds degrees in instructional technology and computer science. So strong pedagogical background as well. In addition to being a member of the Instructional Technologies Group at the School of Medicine, Mary Frances Ipma-Wong is the faculty member responsible for medical microbiology laboratory courses. With a PhD in medical microbiology, she has also taught microbiology, molecular genetics, virology, and basic biology to undergraduates over the last 15 plus years. Keenly interested in incorporating technology into the curriculum, she became a member of the School of Medicine Instructional Technologies group when the first class of medical students was provided with iPads in August 2010, so it's still fairly recent. She works with students, faculty, and staff to develop the iPad program, as well as to facilitate curriculum and faculty development. And her schedule of workshops for the College of Medicine is over here on this table. While teaching the medical students this past fall, she replaced the traditional lab manual, which is of interest, I know, to several of you here, with a custom iBook lab manual, which includes slideshows of images, videos, and links to EEE. Come on in. Before our panel gets started, I would like to just point out a few things on your table. First of all, the legal side sheet is all of the workshops and colloquia that the TLTC is offering this quarter. And the blue sheet there is a feedback form that we would greatly appreciate you filling out at the end of today's session and just putting in the box back here on the little table. So, without further ado, I will turn it over to Warner.
Well, thank you everyone for letting us have this opportunity. Now, before we get started too much, we'd really like to tailor this presentation as much as possible to your expectations and just interest and needs in a digital curriculum and what we've done. So ideally, if possible, could we maybe have everyone introduce yourself, what campus you're from, whether it's biological sciences, physical sciences, and if there's something in particular that you'd like to know more about, whether it's iBooks or podcasting or just device management, and that way we can kind of tailor some of our examples specifically to your programs, if possible. Do you mind if I begin with you? You can just tell me what campus you're from. You're from. Okay, great. And is there anything specifically that you want?
I'm sorry, I didn't hear that. What school?
Chemistry.
Chemistry. Oh,
Perfect.
physical sciences.
Perfect. Physical sciences. And any specific issues you'd like to hear more about, or just everything in general?
Actually, I'm a faculty of Chinese.
Okay.
I'm a business scholar of
great.
UC Irvine.
Great.
And I want to know, because I'm a medical university faculty,
Great.
so I want to know how to use this iPad to teaching the medical students.
Great.
Yeah.
Great. We
So
can do that.
I'm
We can do that. We can do that too. All right. So.
I'm Myra Ruiz, and I'm with the Moreau School of Business, and just looking to get an overall view of what you all are doing.
Hi, I'm Cheryl Hathaway. I'm a senior instructional designer at the Teaching Learning Technology Center, and I'm interested in all the things you're doing at the medical school of Great.
My name's Steve Franklin. I'm with the Office of Information Technology and taught for many years in information and computer sciences. I guess what I'd be interested in addition to everything else is how this has promoted lateral learning, cadre formation amongst the medical school students, their use of it, use of technology in general.
Why don't we go with Nancy?
Ecology and evolutionary biology. I'm interested in hearing about outcomes. What sort of assessment's been done, and
Great.
do students actually learn something, or do they just have a lot of fun with the toy?
Great. Nancy.
I'm Val Henry, School of Education and Math Education, and I know that our teachers are starting to use these out in the classrooms, so I'm just trying to figure out what's up.
Great. Great.
I'm Ramesh Arsasingam, and I'm from the chemistry department. I teach freshman chemistry, so we deal with very large classrooms. And I'm interested in seeing how chemistry textbooks have increasingly got very expensive. And so how do we transform to some form of ebook, but that's also interactive?
Great. Luis.
Luis Medina, School of Medicine. I'm interested in seeing how it all fits together, how it was put together, and also measure outcomes. How is it that we know, make sure that students are learning and using the tools? Chris O'Neill from the Teaching Learning Technology Center upstairs. And I'd be interested in do the iPads, how to put it, do they reinforce a didactic approach, or do they encourage instructors to break into more active, more case-based, sort of different styles of teaching?
Mark Warschauer, a professor and associate dean of education. My main research area is technology and learning, and I have a lot of general interest in the topic. Beyond that, we started having some discussions about remaking our own teacher education programs along the same lines of what you're doing in your medical education programs, and we want to learn as many lessons as we can for everybody who can do it. And I feel that.
Great, thank you.
Ron Coons from the Department of Medicine at the medical school, teaching clinical ethics to medical students and residents. Interested in how I can give students something to be thinking about, because their interaction with actual situations is the best way to learn medical ethics.
I'm Dr. from Chemical Engineering, and I'm a PhD professor from South Korea.
Great.
With the JL visa. And I will return next campus August.
Great, thank you.
Sandra Patan from the Department of Mathematics. I just want to have a general overview of
Great.
how to use the
Thank you for coming.
Maria Guzman, I'm from Physiology and Biophysics, and I was teaching introduction course to neuroscience, neurobiology, and I'm very practical in just how to develop fossils and all that.
Oh, great, perfect.
Dennis Silverman, I'm in physics and astronomy, but mostly from our Lifelong Learning Institute. And I like the way you can do better things in presenting lectures with it. And also it's very portable. It turns out in our Lifelong Learning Center, the visibility is very good. And so if people in the audience can bring their own equipment, then they can see much better what's going on.
Terry Ellen, School of Social Ecology. I'm curious how you handle the management of the software and hardware issues for each field for me.
Great, I like it, great question. Everyone knows.
Dee Gallo, Teaching, Learning, and Technology Center. I'm also interested in how it can make learning more active for students, but also there's this interest in sort of co-opting the students' equipment so that we can keep them more on task instead of using their tools to do other things.
Depending on the development of cell biology, School of Biological Sciences. I did cell biology, so I'm interested in knowing how to use iPad, particularly because I see a lot of students having the iPad and using it for other things. And so it's important to have an online system where we all interact. But also I'm interested if you have any ideas on using the iPad for problem solving things, so that, while I explain problems, as they can work on it online.
Great.
Deborah Mosey Mallets, I'm from Devon Cell, Wisterton, and I'm also, like Nancy, very interested in the outcomes, but I'm also interested in the challenges that you faced implementing this program.
And you in the back?
I'm Dennis Elkhorn from math. I just want to see what's up.
Cool. I think we someone earlier.
Yes.
In the back.
I'm Beth Dennis. I'm in the School of Education, and I have two interests. One is to think about using iPads with our own students in teacher preparation, but also how to think about supporting them to use iPads in their teaching. So there's sort of two layers to this as a formative assessment tool.
Great, great. Did I catch everyone? Did everyone get a chance?
I'm accumulating. My name is Shu Liu. I'm from the University Libraries. I'm new to UCI. My title and position is Digital Resources Librarian. So I'm here because I'm curious of its impact on library collections and our approach to support campus education. I don't have an iPad yet. I think iPad is just a huge iPhone. I want to have one. I'm a Mac user, so I don't know. Like what that guy over there said, that it's see what's up.
Great, no,
It's
great.
like a swimming pool, there's a huge toilet.
Exactly. So what we'll try and do today, I'm going to give just a brief overview of what we've done at Irvine, kind of the 10,000 foot level, kind of highlight some of the interesting things that we've accomplished in the past 2.5 years. Have Sharam kind of speak on his perspective as, first and foremost, my boss. But secondly, as someone who is a leader within the School of Medicine, as as Associate Dean for the clinical curriculum, as someone that has decisions and can guide the way that the curriculum is going. Why does he feel this is important? Why does he support us? How does he feel about some of these items with outcomes or launching a program that virtually has been untested from its inception and supporting it? And then Mary Frances and Julie will focus more on specifics, case examples that we've done, how to use certain applications, items, apps, other areas that could address some of the questions that you have here. And then pretty much if we, when we go through all those pieces, I want to make this as interactive as possible and kind of breaking it into small groups or just answering questions specifically to what you have. For us, myself and Mary Frances and Julie, we spend most of our day when we sit around and talk, we have questions just like these. And how do we improve, teaching for medical students? And this could be a whole day's discussion. So these are all extremely good questions. I hope we can cover all of them, or at least scratch the surface on them. At the very end, we'll have all of our contact information. We're just sort of a short walk away, so we can easily meet up and talk more. So just to give you the quick kind of guided tour of what we've done with our I'm in Ed initiative. I'm a bit of a wanderer, so if all of a sudden you see me wandering next to you, please don't be scared. So a lot of this impetus for our program came about from this kind of quotation that sort of sums up.
It might get a little too dark. You wanna try it, Chris? Yeah. We keep taking bulbs out and then it gets too dark.
I think it's
Better?
That's perfect.
Okay.
That'll work. So in general, medicine is at a transition point, with electronic health records, when paper is becoming obsolete, technology's coming up with faster and faster delivery options and care for our patients. And as medical instructors, we expect that when our physicians are practicing, they adopt this technology. But there's a disconnect there. We expect them to use technology, but we don't really teach them how to use it. And so I think it's our responsibility in general, and part of this program is about that. How do we train our future physicians to use this technology and to critically appraise it? Because just knowing how to use an iPad is not enough, I think. Understanding the whole landscape of what technology means to medicine and technology means to patient education and care is the bigger picture that I think is the most important part. So I'm at Ed. Yes, it is a very easy play on the Apple naming convention, but what it really is supposed to stand for is, medical education that is interactive, medical education that is innovative, and also to some degree education that is independent. So, we don't have to be restricted to a simple classroom environment or a singular lab environment to teach our students, that they can now have all the tools at their disposal on a single device where they can really learn and synthesize and process information anywhere they go. And for us, it's been a lot more than just the iPad itself. It's really been this comprehensive reboot of our entire medical school curriculum. And Sharam could probably speak to this as well. We've incorporated the iPad sort of as a catalyst for discussion. Everyone is now really talking about the curriculum. Whereas before we sort of just, we were status quo for a lot of items. We fixed things when problems arose. Now we've been, as a whole, the administration has been very proactive in finding ways to incorporate new technology and making our educational process much better for our students. And the big question, this is sort of the largest question of why we're doing this, and in medicine, change happens at a relatively slow rate when it comes to medical education. When you think about the way that medical students have been taught historically, really for the past couple hundred years, nothing has changed. There is a singular individual or a small group of individuals that have all the knowledge, and everyone stands around either in a small environment like this, in an operating room, and learns by seeing and experiencing. Fast forward a couple hundred years, same sort of thing, 1902, surgery demonstration, the same sort of environment. Everyone has to be in a classroom environment to learn. You move forward to today, modern medical school, same thing. You have a lecturer in the front. It's a very passive process. I speak, you listen, you learn, and that's really how it's been. But if you think about just the students who we have today, I mean, someone mentioned that they've already seen in their courses students with iPads. You don't know what they're doing. They could be playing Angry Birds for all you know. They could really be synthesizing that data, but they have these devices already, and are we addressing those needs? And so to kind of put it in perspective, there's, who is driving this change? It's not so much us. This is my son at the age of, this was 10 months, I believe. So at 10 months, he learned how to unlock my iPad. Sorry, 13 months. He can unlock my iPad and look at pictures. At 20, let's forget now. At 20 months old, he can go through and he could find his apps, which are in a little folder. He could pick his puzzle, play with his puzzle, solve the puzzle, get a new puzzle, go on to Netflix, which was a interesting piece for him. But he could do this at 20 months old, right? So if you think about, these are children that are currently doing this right now at 20 months old. So it makes us think, well, what happens when he is 20 years old? What happens when he's finished with his undergraduate education or finishing high school and he wants to go to a professional program? Is our medical school, is the way that we teach medicine equipped to meet his needs as far as technology is concerned? And the answer right now is no. I mean, our medical school could not keep up with him if he kept on that pace by the time he was 20. And so when we think about higher education, is higher education really advanced education if we're not using the current tools that are being used out there? So a lot of these sort of just more philosophical discussions, I want to just give you a perspective of this is medical school for the most part. This is a small portion of what the handouts are for the first year of medical school. This is the first half of the stack. This is a video from YouTube of a student from the University of Miami. And these are double-sided, printed, 4 up on a page, so 4 slides per page, front and back, for all the courses. And so that's about several thousand pages. That's a stack of our textbooks for the first year. So 33 pounds, and depending on how you print 48,000 pages, that is all the information you need to know for your first year of medical school. And that seems just a lot. So when we talk about this whole independence of medical education, imagine taking all of that content and putting it into one device, searchable, that can really go inside the student's pocket. Just possibilities from that simple backbone of portability. So,
did you redesign it?
Those are surprisingly the standard pockets for medical students. And historically, before the iPad program, they had a very pear-shaped to them because they had about 10 different pocketbooks they would carry with them, a stethoscope, Dr. Coombs knows. These students would they take off their white coat and it would fall to the ground with a big thud. It would be, a 15-pound white coat because it had all this stuff in the pockets. They still hoard in their pockets, but it's not as bad as before. And so when we talk about just sort of the nitty-gritty of what we've done over the past 3 years, we've distributed over 320 iPads and cases to our students, 15 digital textbooks, more apps and online code and subscriptions than we can even count, 75 faculty and staff iPads, reinvested in our podcast capture system, and of course, student and faculty development pieces. When we talk about what have we actually provided to our students, we're dealing with 32 gig Verizon 4G iPads. Now we're not paying for the service, but we're paying for the device to actually have the 4G. There are locations in their medical training where they will not have internet access if they're in a clinic, if they're volunteering abroad. And so that way we want to have them at least have the option to have access to the web to access their medical information. And the other thing that's important too that separates us from other programs, these are the student devices. We were fortunate enough to receive grant funding, a donation source from a local business is funding our program for 4 years. And so the students have this device and they can own it, or they own it. In theory, they can take the device, go on eBay, have a great weekend with this new money. But the nice thing that the flexibility has done by having the students own the device is it's their device. They really feel attached to it. And when they think they need a new device, the students sell the device and get a new one and move forward. This is just kind of sample numbers of what our budget is. Our team, the 3 of us here, were approximately 1.6 FTEs. Actually now it's 2.2 FTEs total, but it doesn't require a whole army to pull this off. Just a list of the textbooks that we've provided. There's a website here that has a full comprehensive list that we could share afterwards. and a list of just the partial list of apps that we provide our students that have been curated and collected over the time. So when we just talk about technology as a transformative tool, these are all the tasks that we sort of expect of our students as they go through medical school. Note-taking, studying, portability, accessibility, these are sort of the keywords that have come up from surveys just about usage. The main thing I want to focus on first off is the student ownership of the curriculum, this concept, which I think has made us probably the most successful out there, because really it's our students that have been driving this whole program for the past 3 years. And so this is a quote from one of the more innovative medical professionals out there. The medical culture is not only uncreative, it is anti-creative. There's a lot of establishment and rules and hierarchy, and it's very easy for students to not innovate. So I want to give you examples of what our students have done just on their own, really without our guidance to make this possible. The first thing is, you're looking at our team right here. To support 300 plus devices, it's kind of hard to do that with the 3 of us. The students have sort of banded together. There's a group of them now called the Innovators Group. There's about 20 to 30 of them, and they are the super users. Some of them are self-proclaimed techies, some of them are self-proclaimed Luddites when it comes to the technology. And they put together these talks that we help guide them through. These are Tech Talk Tuesdays. It's a brown bag lunch session where they go up there, and much like an open mic at a jazz club, they say, all right, I'm going to talk about how to use Dropbox, and I annotate the markup of PDF, share it, and sync it with all my notes so I can do that. So I'm going to talk for 10 minutes of how I do that. Someone else will come up and say, hey, for note-taking, I like using Evernote, and here's my workflow. Someone else will say, well, what about Goodreader? And so they'll have this kind of student-run discussion on how to make the device more useful based on their own experiences. And for us, for the cost of a couple pizzas, or now just a bag of cookies and some soda, we have this great interaction with our students that now faculty are coming to, staff are coming to, because it's a very low-key environment where people can just ask questions, much like this environment, about how to make your iPad work in this specific scenario.
Not to be snarky, but I'm assuming that it's not always all names of these things.
No, you are correct. We have one token people.
Yeah.
And so for the students that can't make these sessions, we have students that now do their own podcasts of instruction. So if they can't make it to a session, some of them, like this is Kate Z, she has the most amazing handwriting I've ever seen, and she has even better handwriting on her iPad. So I asked her, well, how do you write on your iPad? And she said, oh, I was buying this stylus, I kept breaking it, and so I just figured out how to make my own stylus that costs about 15 cents to make. And so she started making them for her classmates, and then she started teaching her classmates how to make them. And now on our iTunes U site, this is probably one of our most downloaded videos that she has up there. And so she has a small army of students that make her own stylus that they use for their own purpose. But she had a need that she couldn't find with a commercial product, but she made something happen. So again, it's sort of just an interesting case and kind of neat to watch. Now, one of our other, I think, more proud achievements is, this is David Tran, who's now a third-year student, but after his first year, he said, this iPad's been pretty cool. I like it, all my information's on here. I'm going to Hanoi for the summer to do cardiology, work in a clinic there. And half my time's gonna be in the county hospital, half my time's gonna be in a rural clinic. I really don't know much cardiology because I'm a first-year medical student. So what can I do? What can I take on my device to teach me cardiology in rural Vietnam? So we put together this kind of concept of this IMED International, this Vietnam project, and then looked at just how a device that thrives very well in this very connected environment. Here there's 2 different Wi-Fi networks and power cords everywhere. You can easily get online. How does that work in a powerless village in Hanoi for a month? So he had his device for a month. He would go 2 weeks without a charge. We gave him external batteries. We gave him solar packs to charge his device. We gave him hardwire connectors we needed to plug into a landline, and put together this whole sort of proof of concept for practicing in an austere environments, or getting medical data in austere environments. And the more we started writing this experience up, we thought, well, this applies to international aid. This applies to even going to our Flying Samaritans clinic in Mexico, where it's a clinic that has 1 generator and 1 outlet. This applies to post-disaster regions, for what you take with you if you're going to go to a rainy post-disaster, the Hurricane Sandy when I went up there. How do you work in that kind of environment? And so these are students that are coming up with these ideas that, for us, the cost of a couple $100 to buy a peripherals for his device, buy him apps to help him go through there. We had this great experiment that he wanted to do on his own. Now this project has expanded to pretty much mostly every continent. Last summer, we had a team of about 4 or 5 different students that went with an iPad and an ultrasound device to different clinics around the world for their summer projects. And so we had students in Nicaragua, we had students in Australia, using iPads, working with patients, learning about surgeries, looking up data, kind of expanding on this project, and it's all student run. The other project I kind of mentioned, this Flying Samaritans clinic in Mexico, same sort of thing. So it's a free clinic run by our students, paper-based records. The students thought, well, why not the most effective way to help health screens? And so they built their own electronic medical record using numbers, which is like Excel. It was on the device. The device, by default, is phonetically secure as a HIPAA-compliant device. And they brought the same iPad down with them every month. So now they've built an existing or a functional medical record to take better care of these patients. We didn't hear about this till 3 or 4 months after they built it, and they sent us all these photos of them using the iPad to provide better care to their patients. So very cool stuff. We have students now interested in all these new e-patient movements, quantified self. How does a Withings scale, how does the Nike Band, how does the Fitbit, how does that impact your own personal health? Because patients are going to have it. Patients are going to come to their doctor with all these cool peripheral devices. What are you going to do with that as a physician? So our students did a 3-month weight loss study pilot using these sort of devices to lose weight and stay healthy. MyFitnessTracker, Run Tracker, Nike Plus for GPS, all these things that help encourage health. They want to learn more about, because as providers in the future, we're going to have that data presented to them, and they want to know what it means. So one of the other things that some of you may have heard about is we had our first ever Med App Jam this past November. And what it was a collaboration between our students and computer science. Had 19 teams of medical and computer science students, and they had 10 days to build an app from scratch to address a healthcare need. And so our students are finally at that point now where we said, we found a lot of great content. How do we create our own content? We want to find a way to make an app that would be helpful for me, but we can't teach our students how to do iOS development. It's just too hard to do in medical school. But we can teach them how to collaborate, how to do teams with others. So we got randomly assigned to a team, and of the 19 teams, 18 developed apps within the deadline. And the contest went through, and the winning team, the top 3 teams won a cash prize of $1,500 and $250 for their app. So a lot of these apps are going to the App Store now because of the student development. And of course, our students are the ones really driving this, and our students have gone around the world doing talks just like this, speaking about their experience, showing that they really have kind of the ownership of this curriculum. Sorry about the title there, but one of the other things that's been very important for us, and I kind of hinted to this in the bigger picture, is we can teach them how to use an iPad. We can show them how to download a textbook. But what really matters is, how does this really make a difference in the care you provide? How does this impact what you're going to do in the future, right? Because medicine in 10 years from now will be very different than it is today, and are we really preparing our students? So we have all put together this kind of Health 2.0 and digital literacy course that teaches things as simple as digital professionalism, technology etiquette. So if you're in a room, how many of you have been to like a Kaiser or a medical clinic where you go in there, there's a computer workstation in the room, and the doctor pretty much spends the whole time typing on the computer, not really looking at you, not engaging with you anymore. The days of the Norman Rockwell posters are sort of gone because there isn't that degree of engagement anymore. We're teaching our students how to engage with technology with a patient. So little things like that should make them better equipped to practice. So with that, I really want to kind of transition off from the 10,000-foot view of what we're doing and why we're doing a lot of things to some more of the specifics with Sharam and Mary Frances and Julie.
Thank you, Warren. So I just wanted to give you just from my view of being involved with this. I think, first of all, I want to thank you guys for having us here. I want to thank everyone that's here. I think we have an amazing audience with just a lot of great skills, and I'm actually looking forward to kind of hoping that some of your questions get answered, and if not, dealing with them specifically at the end when we have some Q&A time. We, just to give you a little bit of perspective, we feel extremely proud to be part of UCI, and so we have been working with Dee on setting this up because we want for any department, any place that we can offer some of our stumbling blocks that we've learned through and some of the other thoughts that we have at the medical school to give you guys some ideas so you could do it easier, faster, cheaper. I was actually a little surprised nobody brought cost up. That would be my first question as the Associate Dean, and that's one thing that came to my mind. So just to give you a little bit of a perspective, so this started by Dean Clayman and really by Warren, saying, wouldn't this be cool? This is coming out, wouldn't this get started? But then it really went to the students. So I think it's a little different perspective than usually how things happen. Usually the faculty are the ones that, are getting involved, and I think the world is changing, as we all know, and it's no longer just, the instructors instructing, and that term is becoming very different nowadays. So I really want you to realize that our students, as Warren mentioned several times, have been our driving force. So that created opportunities and also lots of challenges, and be happy to address that toward the end on a more Q&A individual or for the whole group. So the opportunity was it spread very quickly. As you can see, the students are excited. There's very low bar to get them engaged on something like this. And at the same time, that would mean that we hadn't fully engaged our faculty. We're still engaging our faculty. And so there, it takes a little bit longer. So that's the first thing I really wanted to kind of drive home. That's important to realize. That's the way we went about it. That doesn't mean that's the way it should be, but we're happy to tell you what worked and didn't work. The second thing that I want you to also kind of drive home with you is that for the couple of medical professionals or others that are familiar with medicine, I just want to tell you that we're behind the times. So for us to pick this up, it's probably, we got more barriers than you have, because you in a lot of places that you are, we teach the way it was taught. I mean, we still use a stethoscope that from 200 years ago. So, I mean, there's a lot of things that are very simplistic about how we approach it, and some of it's tried and true, and that's why change it. But I'm also bringing you the ideas that, compared to the rest of the world, Australia, Europe, most of them are using electronic medical records, if not all of them are using electronic medical records. Until recently, only 4% of the US was using electronic medical records in any significant degree. And probably it was all Kaiser. So, so just to give you a perspective, medicine as a whole had to have a government step in the United States to say, you have to use technology. We are wasting resources. We're redoing tests. People are not sharing information. It's just, things aren't happening. So we viewed this as really a catalyst for everybody to come together. And I think that the lessons, although there's a tremendous number, we talked about some of them, we'll talk about some more, about the educational aspects of it. Using technology for our needs is a critical need for patient care. And just to give you one living example, it's electronic medical records. So electronic medical records, we've gone through all the different computer systems, right? We had the whole DOS-based system, then we had, Apple, and now all this stuff, and now all this touch screen. Electronic medical records is still in 20 years ago. So it's evolving. So I'm just trying to give you kind of some perspectives on where we are and where we need to go in medicine. And so some of the use of technology to reach information that is just exponentially expanding in medicine, ensuring that what we're doing is correct. Double checking medication doses so the patient doesn't get the wrong information, not just by memory, but having a way to do that. Making sure that if I ask you, to help me in caring for the patient, that there wasn't any loss of transmission of that information between one healthcare provider and the next, requires a lot of things that we haven't traditionally used in medicine, and technology is trying to build that void. It doesn't change the fact that how we take the history, it doesn't change, it could be aided by technology, So you're not asking the same questions every time you go to the doctor. Maybe some of those questions can come back and you can double check them. Maybe you can look at several records, accumulate some of them, so you don't ask the patient the same questions. The same thing about medications. You know, nowadays it's a requirement in the US that all medications have to be electronically transmitted to the pharmacy. So, you know, you infamously knew, you know, doctor's handwriting is, you know, as old as time. Nobody could read the doctor's handwriting. Well, that's terrible because it was misread half the time or a third of the time, or they wrote it wrong. And so that is getting eliminated. So I'm just trying to bring up the part that this is not just an educational tool. Now it's becoming a necessity. When we brought it up as an educational tool, but this is now becoming something that becomes more and more important. To be able to take technology to the bedside and help use that to explain to the patient what's going on, that's new. That's not something we could do without such technology. You know, you can't take them to the computer wherever it is, no matter how small it is. You know, we have these things called cows, you know, computers on wheels. And so you can't, you know, they're not that portable. Obviously, the iPad's very portable in the student's pocket, and we can take that to the bedside, use it as patient education, explain to them what's going on, you know, email it to them, fax it to them, however way you want to get that information to them. All the different tools that we weren't able to do just very recently. And students are using that, and we'll show you some of those examples for patient education. But they're taking the lead a little bit on that because all these apps are out there. It's not a matter of creating some of them keep getting better. And so there's multiple dimensions to it. And I think a lot of it comes, for us, so far it has come to the team. You know, we have an amazing team that has grown together. And, you know, we didn't start with this, you know, all the pieces keep coming together. I think the students have really stepped up to realize that nothing's perfect when it starts, and you know, how do you get it all implemented, and we've worked through it. And they've also interfaced with multiple other medical schools that have jumped on this bandwagon. If you imagine, somebody mentioned chemistry, you know, about textbooks getting more expensive. I don't think there's anything more traditional than medical school textbooks. I mean, they are just this. So we had to, you know, along with the help of Dean Klayman and other schools, break down barriers for these publishers to even consider. You know, they're paranoid as can be. You can imagine publishers to say, you know, let's make stuff electronic and available to the students. They were like horrified, like we were like, you know, taking their children away, you know, like, oh my God, you know, how am I going to feed my children? You know, these multi-billion-dollar companies were telling us, you know, I'm going to go hungry. And so they had to get through this stuff. So there's many different dimensions that, you know, we've worked with a lot of great collaborators to go through. And we had the dean telling publishers, if you don't do this, we're going to go to a different textbook. You know, if you don't make these textbook available, and that's the first step. Now they're making them more interactive. That's what we knew that would come. If they first made them available electronic, we knew the next step would be more interactive textbooks. And you know, the whole iBooks it's just in a whole nother dimension. But I'm just talking about having the stuff electronic, having it being able to. And we have lots of pictures of our students that don't just use one device. I mean, we keep talking about the iPads, but they have their computer open, their iPad open, something else open. I mean, they got like so many different things that you're like, how do you even concentrate? But that's, you know, part of, you know, some students' way of learning, you know, which is getting lots of different pieces of information. And I just want to stress to you, for us, using technology is becoming a necessity in some respects, but it's also a barrier in some respects. So I think for patient care, it's becoming a necessity, but it's also a barrier because it can take away from the doctor-patient relationship. I mean, nobody goes to a doctor, so, you know, they could say, well, why didn't you look it up, or what did you look up? You know, they go for that interaction, hopefully, still. And so that's a big challenge for us that we need to overcome when in our curriculum, because you know, you're not going to see a doctor and say, oh, they were technologically, you know, very good. You know, hopefully we're still looking at it from the doctor-patient relationship, and you know, their keen awareness that, you know, they want your best and they'll do whatever is necessary. And I think technology, iPads, iMedEd, is making that more a reality than in the past. You know, they're more stressed, the physicians, for their time. how many patients they see, and I'm hoping that this will make it so they can offer better care. And then your questions come about, how do you assess it? How do you know it's working? I think those are very valid questions, and we'll have some thoughts on that. So just want to say thank you for having me here, and I will pass it back to Warren.
Let's go with you, Mary France. You should sit up here.
There you go.
Let's see. I've got it.
To answer someone's question, as Mary Frances is getting set up here, what was one of the first biggest pitfalls we had? And it's actually quite an easy concept. It was expectation management was probably the biggest problem we had initially. When we first started, the landscape in 2010, August 2010, was not very robust for a lot of the content that was out there. There was a lot of content in general, but not a lot of great medical content. And there was the assumption that the students had that we probably didn't accurately address from the beginning, that they get an iPad, they're going to have all their content, and now medical school will be easy. And so we had students that would finish their first round of exams and do terrible. They didn't study, they didn't prepare well, they were scoring 70%, and they'd come to us and say, Warren, you gave me an iPad, you gave me all the content, I'm not doing well in my classes, how come? I said, well, medical school is still going to be hard. It's going to be still, the most overwhelming thing you will do. We're providing tools to help improve your process, but it's not going to make it easy. And sometimes just saying that little aspect of this is a set of tools to hopefully make the whole process easy or easier, just helps sort of couch the discussion. Admitting that not every content is going to be good. Not every textbook is going to be to your liking. You may find it's better to use paper. You may find it's better to use paper pencil or your laptop. That for us to think that your iPad is going to be the only tool you're going to use throughout medical school is almost as naive of us to say that the only way you can learn is by going to lecture and taking notes by hand. So there's very clear expectations that we wanted to set up, that it's not going to be a perfect system, that there will be a lot of variability. And after we sort of made that realization, I think it helps put the students on the right track for at least moving forward.
So I work with the students, especially at the beginning of the year, getting them set up with their iPads. And then throughout the academic year, I end up working more with faculty, helping them understand what the students have, being sure they have similar, if not the same resources, and then work with the faculty just in their teaching as well. So I'll sort of start from the beginning. When I was hired, we realized we need to put all the resources in one place so everybody knew what we were doing and what the students had. And because I have some peer instructors in the room interested in curriculum, I'll try to address some of those points about what the textbooks are. I think that's important. So these are our resources, and we do provide the students with some apps and many of their textbooks. We are providing the textbooks because of our grant, so we have the money to do that. But cost is always a factor. That is true. So just to give you some detail, sort of everyday detail, is in this, and this is publicly available. You've got a list of all the textbooks we have. And just to give you a bearing of what's going on, of course, publishers create the textbook, but software providers are the ones providing these digital textbooks. So if you look there, and that was real confusing to people at the beginning, you'll see software provider and term. The first year was confusing what provider was best, and the providers weren't so great. But now you're going to see the word Inkling all the way down. Inkling is a software, not all the way down, but almost all the way down. Inkling provides digital textbooks. They're really interactive. They're not the only company we work with, but for us, and we have a lot of feedback from students, they like their books the best. Their titles is how you refer to these digital textbooks. And something you might not think of is, what's the lifetime of these digital texts? Inkling provides perpetual, you have it forever. our first year, some of the textbooks worked forever and they went away after a year, so we had to deal with a little bit of feedback with that. The first year too, a lot of the textbooks, the technology was you downloaded on your iPad and that was it. And I would go home being sort of worried, what if their iPad breaks the weekend before an exam? That is a problem. You're going to see a lot of the providers like Inkly now, you can download the title on 2 mobile devices and you can access it online through the computer. I was so happy when I saw that. So your students get it you can have it 3 ways.
Do they get automatic revisions and updates on their textbooks?
That we will see. We are getting a new edition of one of our textbooks, and I wrote Inkling and said, so what's up? And our incoming students will get the next edition, but they said we're going to have to discuss the pricing to update to the new edition. So I can't give you any more information on that. But that is a good question, and it's sort of new, and I'm not really sure right now.
And
Yeah.
so, you know, again, that's a very valid question, and you know, my question would be, again, this is a new medium. This is a new question for them that they've never had to deal with, and I would see that question will go away. They will get the new ones. I realize this question is with this one textbook, but I think that will get solved as time goes on, especially if the textbook is with the same individual on the same device. I can't see them saying, you know, I'm not going to update the edition. But that's a very traditional question. It's a very valid question because, you know, you had a printed book. Now I'm not going to give you a new printed book, but this is, so those are kind of things that we're trying to work through. And, you know, when I sit down with them, that's what I tell them, at least from a feedback from an individual at a school, that, you know, that should never be a question for you guys. You need to build that in from the very beginning, but I'm sure they have some costs, and we're going to go through some of those questions together.
Yeah.
So does the publisher never provide an online iPad software? Because for a lot of cell biology textbooks, some of them, like Lowdish, they do provide software for iPad use.
Many textbooks will be, the publisher may, they also may go through Inkling, which creates a more interactive product. I have seen books not only provided through Inkling, but through VitalSource, which is another software provider. And I'm not sure how all the publishers and software companies work all this out. What I will do, in fact, we're going into a neuroscience class, is I will look at the textbook that the course director wants and see what platforms it's available on, and then decide from there. You'll see with Inkling, we obviously like their product quite a bit, but I'm open to all types of, you know, how they're provided. But yeah, it's an interesting field, and you can't make a rule about a certain title.
Human physiology, does Living publisher provide the iPad software and compare that with Inkling?
No. For
Which
that
textbook?
example specifically, Lippincott is one of the more premier partners with Inkling, and so they have Inkling do all of their third-party development for them. But another company, conversely, Elsevier, they were going through VitalSource as well as Inkling, but now they're starting to develop their own app. And this sort of led to, going back to one of the other issues that came up initially. I mean, right now, Mary Frances, mentioned that we're very consolidated to Inkling, but our first year, we had 15 textbooks, probably spread across 5 apps, 6 apps maybe. And so students then had the problem of, okay, I'm going to study anatomy. Which app do I go to? Oh, it's not in this one, or this anatomy book is across 2 different apps. And so it was very confusing of where they would go to get their content. Even though you could search, within each app for the content, it wasn't consolidated. And so even though it was all on one device, it was still very separated on that one device. And so the problem is if you have so many different apps for your core material, so much content, then the students have to start kind of hunting and pecking to try and find out where all the content really is on your device.
Yeah. Yes.
Public Library of Science is probably the premier open source journal, and it comes from this particular area. But there are also pushes for open textbooks. Has that started to percolate into medical education?
I haven't seen any.
Not very well. Not very well.
I haven't been looking the last couple months because, you know, I set this up and I'm on other
Right.
projects. And I did even, you know, our UCI library has some of these textbooks for online access. And the first year I was trying to save money, and we did quite a bit of that, access it through the UCI library. And it didn't work as well as I would have liked. We do survey the students, and accessing through the library, it was just more difficult, hard to annotate, just didn't work out so well. So that's why most of these we are purchasing. Yeah, so that's a good overview of these, the way we're providing our titles. Now, most titles, you know, the students can annotate them, take notes. The Inkling titles, you can share notes. Once in a while, I find a title that isn't available at all, and so I end up asking the students to purchase the hard copy. I think we only have one where that's the situation. And that's right, one title, the medical interview right here, I needed to go to Amazon to purchase that for the students because there is no other way to get a digital copy of that. So they have the there we go. Go back, go away. Oh. They have the Kindle app on their iPad. I don't know why this is not going away. Come on.
Get that little thing on the lower right.
No, it's very good.
There we go. I don't use the on-screen keyboard, so I'm not so quick at it. I have my little keyboard here. Okay, so that is where we are with the titles. We do have some apps that the students use. I annotate pages, keynote numbers. We get them those apps. There are other digital resources we use for histology, or you see that histology time. And part of my job description is to help faculty find apps. So it's not as easy in some areas. Like there are many genetics apps, and some of them are not very good and not very advanced. So, for example, we provide genetics for medics for that genetics course. We buy it through the Apple Volume Purchase Plan, where you get many apps. They can be half off, and we provide it to our students. So that's been getting the right apps has been a process where students will tell us that they like them. We have a way for students to try out apps and tell us whether they're useful or not. But there are so many apps, it's hard to screen them all. So it's a very busy process to get that all done.
Mary Frances, to go off of that point, you know, with that student innovators group, you know, like I said, for the three of us, the four of us to go through all the app content, it's just impossible. And so with the volume purchase program, it's a nice setup where you create an account with Apple, and it's pretty much like buying gift cards. You get a code and you can distribute codes. So we'll kind of mention it later, but for distributing content, we're sort of now in the business of code disbursement, which is something we didn't really plan on doing. But we tell our students, you know, listen, we did a simple survey that said, what's your price ceiling for buying an app? And it's about $4. Anything above $4, the students won't buy their own, which is kind of odd, but that is what it is. But we tell them, any app that you want to evaluate, you tell us. We'll buy it for you for free, no questions asked. But you need to write a detailed review, and we have a rubric for doing it. How would this app help you as a medical student? So you can go on the App Store and say, hey, it's 4 out of 5 stars, that's great, but it's 4 out of 5 stars from some random person that doesn't use it in your context. So for us, you know, we probably spend on apps maybe $1,000 or $2,000 a year, pretty minimal amount. But we have students that write very detailed reviews. We buy it for a couple more students. We get 15 or 20 that really like it, and then we incorporate that into our purchase for next year based on their feedback. And it's a pretty easy mechanism, which for us, I mean, $2,000 a year is much less than a work study, much less than an FTE. And for the students, they love getting free stuff. I mean, if you bought them a pizza and some soda, they'd be happy. If you buy them an app they can keep forever, they're even more ecstatic, because that really takes that risk away. And that's been one of the just simplest things that we've done has
Mhm.
been probably the most effective for just discovering new content.
Yeah, everybody feels good when you're doing that. Just to give you an idea of what an Inkling title looks like, this is it. I only own chapter 3. I'll show you another book where I own a little more. But the nice thing is this is not just a PDF to be annotated. They have created chapters that then work into cards with the visuals, and then you've got your text here. And you can certainly take notes and highlight the text. Now, I have some chemistry people in here. I think you'd sort of like to see this. Inkling has incorporated three-dimensional models. They also have what they call a slideshow. If you are teaching about sickle cell anemia, this is a wonderful tool for the students where they can actually see a dynamic diagram that's walking them through the molecular basis of sickle cell anemia. And I heard the word cost. The nice thing about Inkling is you can buy it by the chapter, and chapters are maybe $3.99. And many of us teach and we don't use the whole textbook. We don't need the whole textbook, and this is a really cost-effective way to do business for the students. I want to show you something else. Let's see. Oh, I know. I was teaching on translation, and I couldn't find a video that I really liked. I was not using this textbook, but I went and just bought the chapter. And this is a wonderful video of translation, protein synthesis, and the students, can view it.
This student is cramming for her biology test with only a frosting-covered donut for lunch. Specialized cells in her pancreas respond to the increasing amount of sugar in her blood by releasing insulin, a small protein that regulates blood sugar levels. Let's go inside one of these cells to see how this protein is manufactured.
So in terms of cost, that's a nice thing to be able to do. Now you can either ask your students to buy that chapter, because now you know they can watch it on the computer even if they don't have an iPad. Another real inexpensive way to do it is if you're using UCI Replay and you're doing this during your lecture, you have now captured this for your students. And I think that's a great idea to do something like that. The Inkling texts also have quizzes within them.
There's a question.
Yeah.
I was just curious about the copyright issues of that.
I think if you said UCI only on Replay, I guess in my mind that would be fair. In terms of copyright, also just as a sideline, I ran into this with my biochem folks. We provided their textbook via Inkling, and the instructors did not have instructor access to all the figures, that you would use in your slides, etc. But the publisher worked with us. So while we were buying it from Inkling, then Lippincott worked with us and made sure that all our instructors had, the access that many of you have with a textbook. You might not think about that until, a couple days before the lecture, and then you're like, oh my goodness. So that's nice to know. Let me go. I wanted to show you one more thing. In the biochemistry, there are quizzes that you can take. I'm going to continue my quiz. And the great thing about the quizzes is you not only take them, but there's feedback within these. So this is, some of the online sites that publishers are creating now have this feedback, but it's nice to have it all in one device. So you get feedback. I don't know if I can now answer this wrong. Let's go to the next question. I won't even read it. Hopefully I'll get it wrong. I got it right. Okay, we'll go to the next one.
The answer is always A in all the textbooks. It's weird.
Okay, good. I got it wrong. And so, it gives you that feedback. And that's a really nice feature. And again, if you could encourage your students to buy a couple chapters for $3.99, it's great. I sound like I work for Inkling, but I do not. I do not, and there are other textbook
Can I ask a
providers.
question?
Yes.
You said the right answer is always A. That will not work with undergrads.
So that's an overview showing you why we think many of these titles are very useful to our students. And again, we use AAA to survey them. And at the end of the first year, I had a very clear idea of what textbooks we were providing that are titles that were not useful, and we took them off, we changed them. I worked with the course directors. But most of you have a simpler situation. You are teaching your course, you can choose the textbook that best suits you. And actually, all these are Inkling support. These companies do give good tech support. Yes, Chris?
What's the storage on the iPads you hand out?
Sure. So we initially did the 16 gig for 2 years, and now we're doing the 32 gig. Most of the textbooks, so the nice thing about the Inkling titles, and actually most of the digital textbooks, is they retain local copies on the device. So you can be in an airplane and still have access. And all of our textbooks, if they're fully loaded up with all the videos, I think it's 8 gigs for 15 textbooks. So they're pretty small footprint devices, and these are pretty heavy in videos and diagrams. And so, you know, we were okay with, 16 gigs per year has not been a problem, but then our long-term goal is that this is their device for 4 years, and at that point they're gonna have to start picking and choosing what stays on the device and go from there.
Just to build off that, and sounds very big brothery, but is there any tracking software you guys can load on these to see how they're using them?
Oh, I wish. That's the
But-
one part of.
Yeah, but I think along with the tracking software, we didn't talk a lot about, we've surveyed them. So
Right.
instead of tracking software, we voluntarily surveyed them. But I think what we did do, for what it's worth, is we worked very closely, not unlike OIT, the Health Affairs Information System at the Med Center. We were more concerned about, instead of, although as important as tracking, we surveyed them about what happens if these devices get lost, So we worked very closely to secure them. So these devices are secured, all of them are password secured, remote wipe, all of that. So that took a little time to do all of that for us to figure all that out. But, we put significant safeguards in, because we're very concerned about what could potentially be on this, where does it end up, what happens, how do we wipe it, and we spent quite a bit of time on that, and we're still working on that at every point.
And we have an orientation at the beginning of the MS1 and MS2 and even MS3 where we do give the students some guidance, like find my iPad, get it on, be sure you're set up. So we spend many hours with the students before the beginning of the year. So most of you undergrad instructors, that would be different for you, but you would want to give them some guidelines. So,
Follow-up question in terms of the tracking, not so much on the iPad as to what people are using, but do any of these publishers do tracking and analytics on use of their materials, in particular which chapters are most heavily used, which questions, what type of things? Do any of them do that?
No one shared it with us yet.
Yeah, so we do work with, part of med school is all these standardized tests they have to do. So we're working with one company called Firecracker, and they're actually, the students are voluntarily enrolling in that. And they're letting us look at all the analytics. So, but that's more of a standardized test preparation. So we are looking at all the analytics, how much students are using it, and then we're comparing it to test results on that particular one, because it's all standardized tests to see how that compares and how the student experience. But none of the publishers are even close to that with us.
Right, exactly.
It would be nice.
I mentioned that because that seems to be a major theme developing with companies like Coursera and Udacity and edX, that they do want to capture learner analytics.
Right, exactly. And even we use it's called AirWatch. It's a mobile device management software to keep track of all of our devices, serial numbers, etc. Even that, with the current Apple restrictions, we can't do even just general usage, like how many hours per day is the device on, things like that. And so it really limits us in that aspect, and a lot of the usage becomes self-reporting data, which that's fraught with its own problems for.
No, I was thinking much more in terms of understanding the learning patterns and so forth, because that would seem to be one of the advantages of people having electronic
Yeah,
resources.
yeah.
Can I ask a question?
Sure.
How many students have their programs downloaded both on their iPhone and iPad?
I don't know.
A good amount. We have the incoming surveys we typically have. I mean, our iPhone population is about 70% in our students, and most of the content is, you know, dual formatted. So we kind of teach them in their boot camp at the very beginning, you know, how to turn on automatic downloads so they can sync content across their devices. And so the large majority of them have that. Most of their phones are larger in size than their iPads are, and so they have more than enough space. The nice part, even though it's not the best for reading, you can read all the Inkling books on your phone as well. But we've had students that just anecdotally say, well, if I forgot my iPad, I can still read that chapter when I'm, you know, waiting at Starbucks for my coffee, or I can do the quick 10 questions at the end of the chapter while I'm, you know, waiting for so-and-so, or while I'm watching a movie and the trailers are going on. Those kind of things they are doing now. And so, you know, again, it's hard to quantify that, but we have a lot of just anecdotal stories where students are saying they're studying more in general, but in smaller snippets of time and in different locations. So instead of holding up in science library for 10 hours with a rolling cart of 12 books, they can now hop from place to place and study on the go.
And I'm Warren and the team knows more about the numbers of iPhone versus iPad. Initially I was more concerned that it would be iPad versus computer, so at least they could use it on both formats. So that was my main concern, because I still envisioned, you know, at least until this is up and going, the students would really like to use their computer. That's what I envisioned, and I wanted to make sure that we could use it on both of those devices. And you know, we have students that their computer's open, their iPads are up at the same time, with different material on different ones, and maybe some print material in front of them as well. So I think the iPhone, for example, either for questions or in the hospital setting, it becomes a lot more important, and it's secure. They've created the secure connection, so you can look at patient labs as they come back. So you can look at that. You can look at patient x-rays. You can look at a quick note. I think that becomes really good. Or you can look at a quick app to just look at all the 10 questions I need to make sure I need to ask this patient. Did I forget something? I think for a very short period, I was mainly from an educator more worried about the laptop and the iPad.
Yeah. And at our Tech Tuesdays, we'll have students show their workflow, which will be all these different devices that they share that at the Tech Tuesday, so others get that idea. And then just back to the Inkling textbooks, if your iPad can't accommodate all that, data, you just you don't really delete it. You delete it, but it's still in the cloud and with all your notes, and you can bring it down when you need it, because they do get big after a while if you have a lot of textbooks. Yeah.
Since so many of these textbooks do have the interactive videos and the self-tests and everything, do you have any data that shows that the students feel that they're learning better having the data presented and that information as opposed to just a static textbook?
In our surveys, the students absolutely love it. They love the quizzing. They love the videos. Hard data to say, how many are watching and how many times, we don't have that.
Is there anything that you've got that shows the students' performance on tests in this cohort since they've had the iPad as opposed to prior to having the iPad?
That's hard to measure because things change in the medical school. The year that the iPads came out, we redid the pharmacology course. No, the year after we did the pharmacology course. We have 100 faculty teaching and 14 courses going. They did score better on their USMLEs in the last year, which we could attribute to the iPad, but I think it's also to our fine teaching. And we just started a new immunology course. So that's, in our context, that is a little hard to measure.
So sort of following up on that, though, you mentioned at the beginning that one of the sort of byproducts of going digital was that you had to rethink and revise your curriculum. And so I'm wondering, along with that, were there changes in pedagogy as well?
Yes, and I think that now that one of my responsibilities is to be sure that the faculty have the titles as well. They're seeing how much is on those titles. So in a way, when they're working with the students, they don't feel like they have to cover every single thing. They can refer to the titles in certain sections and let that be, you know, the way the students learn that material so they can discuss more higher order issues.
So just so you realize, you know, we have data back from our first exam of the USMLE, which is a world standard, standard exam, and and I absolutely agree with Mary Frances. You know, we can't say that's what it's from, but I can tell you we did the best that we've ever done in 30 years compared to the nation this past year on step 1. So again, you can't say it's because of this. We've redid all of our courses. All the courses are getting better. We're more engaged under Dean Klayman than we've ever been in medical education, at least as long as I've been here. So all of those play in, but one hard number is we did better than by a standard deviation than we've ever done at UCI on step 1 of the National Board's standardized exam, and by more than almost a standard deviation.
Oh, we got a lot of busy people over there. Now I've talked about the titles and the apps that you can purchase. In my role, I can see that content that's designed to your course, like an iBook, it can be very useful. For example, I teach a medical micro lab that is, it's only 8 sessions. It doesn't have to be too far, too much in depth, but it has to be more breadth, that the students cover certain things and also that they see in the lab what's being discussed in lecture. And so in my position, it was rather easy to set up making an iBook for my lab. I collaborated with a young man getting his master's in education at the University of Hawaii, so he did quite a bit of work to help me with this. In fact, as a side note, you'll often find people working on their master's in technology, but they need material. So I had the lab manual. I had some good figures and diagrams. I had worked through the lab manual many times, so I knew it was good, but I needed it digital. And so we worked together, lots of emails, lots of time. But I'll show you some things that I've done with micro, and hopefully you can extend it to your own specialties. Now, John is his name. He needed to provide something in his Master's of Education program, and he made a very simple iBook to test how well the iBook is working. He hasn't done it yet, but I was looking at this with him. And just as a hint, making an iBook for he had a little how-to at the beginning of his iBook, because some of the students aren't used to using one. And I thought that was, he's done a great job of doing this. So you might think about doing that. Okay. Now, our students, though, were pretty sophisticated with the iPad, and so I'm going to show you portions, of my iBooks and what worked for me in the lab.
Question?
Yes.
I'm not familiar with the medical field, so do you find all the digital content you have so far meets all the needs, student learning needs? Is there ever students need to refer to some older historical materials that's not available in digital format?
I didn't run into that problem.
Like at all?
No, but this is a rather simple, straightforward lab, and what we're doing is well documented and easy to take pictures, images if I needed to. So this is just giving you a little overview of what it looks like. I won't go into too much detail. This is not a micro course, but micro is very visual. And students walk in and they're really not sure what they're supposed to see a lot of the time. And so that was our job, was to put this all in a very easy, really used format and very visual. And so this, I'm just walking you through this. And something that I found was useful too, if you're working in a lab situation, was that the students could look at the lab or watch the video before they come in.
leave it on there for 3 minutes. After 3 minutes,
Not the most
you want to
riveting
rinse the
video,
carpet fuchs and off
but for the
slide.
students walking in and wanting to be
Shake off the
efficient and
excess.
get things to work,
Then you want
it's
to
very
use
useful.
acid alcohol for a destaining step, and you just add it drop by drop until the pink or the purple stops running from the smear. And it looks
Okay.
like it's going to take 6 or
Right,
7
close
drops,
it out.
maybe in this case. Then you
Also in the micro lab, just again, knowing what was expected to be seen. I don't know how many of you that would be useful, really useful to see. I've taught labs a lot, and I think that being successful in labs is really important to promote our students to go into research. So many students will say, the lab never worked. My goal is success in the lab, and so that's one reason I created this iBook. Students knew what was going on and enjoyed the experience. Let me show you a couple other things that we did with the iBook. In a course, I asked students to create Prezzies. I don't know how many of you are used to or have seen the Prezi tool. And I didn't want to create Prezzies for everything I wanted a Prezi for, so I had the students do it. And they loved it. And then I incorporated some of these Prezzies into my iBook. Whoops, no, I don't want that. I want this. And again, everything's in one place. And these students put together this little Prezi. So they learned, and then the knowledge goes on. And you see it a little bit.
About the superbug. We've heard all this talk about this new superbug, MRSA. So what exactly is it?
MRSA stands for methicillin.
Oh, you know, one thing with Prezi is you have to click right out of the book. It doesn't go back to the book. I was fooling with that. But that's a small problem.
And the one thing that we found that's been very effective with our students is really putting content creation kind of in their hands. And it's been, the tools are so easy to use with either iBooks or even Prezi or even Keynote that, you know, the days of can you put together a PowerPoint presentation, they'd have to go back to their laptop, work on something. Now they can sort of do it on the spot. And there have been many, many examples, both in a hospital setting, in a small group setting, where we say, you know, you have 5 minutes to make a video or to make a presentation on this topic. So they really have to go through and synthesize what they've learned and put it into a more meaningful format. I mean, Julie and I the other day, we were even just talking about the use of Twitter for note-taking. Not so much that we're gonna push that through, but to take a concept from a lecture and condense all of it into 140 characters takes a lot of time to come up with something meaningful. And so we're looking at ways to engage either with, you know, content creation on the iPad or social media, just so that they have to take that step of, here's a bunch of data, how do we make it more useful so that you can share it with other students? So a couple questions.
Do you have a way to make this available, say, to medical schools in developing countries?
Great question. So one of Dean Clayman's missions, or visions, I should say, is that, you know, with this device, I'm going to see your iPad real quick, you know, this is medical school right here, that you can go to a country that doesn't have an established medical program and find a group of 20 doctors who are willing to teach, give them 20 iPads with a curriculum, and then find students that want to learn more about health and sort of build a medical school in a country that doesn't have an infrastructure to do it. So instead of bricks and mortar, you can have now all the content, everything you need on a device. And so, you know, there are mechanisms to store it locally. A lot of our content that we create on our own, we push out to iTunes U, just publicly and share publicly so that other schools here in the US can share it, but elsewhere. I mean, connectivity is always an issue, but all the content we can put on a device and really have a self-sustaining educational unit somewhere.
So, you know, that vision is great, but what I'm hoping even in a shorter time period, which we are not there yet, is just med schools sharing some of their content.
Right.
You know, I mean, again, I just go back to, you know, we have a lot of barriers to overcome. I mean, currently we have all these University of California med schools that, you know, some of them are some of the best in the world. And wouldn't it be great if we're sharing some of that content even among the UCs? So I challenge us to, do a lot of things that we're not yet doing. But I can tell you, most of the countries, there's a lot of countries in the world that don't even have a med school. And that would be a phenomenal vision for us to be able to provide that service to them. They have hospitals, they have doctors, they have tons of patients. They need some of the basic content. And if, this is a way that we could give, but I think even before that happens, it'd be great that we could share some of this between the med schools so we're not reinventing all of this content and using some of the best content to teach our students.
When you guys started this, the iPad was sort of the biggest player in the game, and it was an obvious choice. If you had the same choice of device to make now, would you still go with the iPad or with something else?
I probably would. I mean, we're having a hard time now deciding between iPad and iPad Mini just for the size issue, but the content landscape right now for iOS is so much more robust than any other platform that's out there. The interoperability between the devices is great, and for us, which is more specific to our needs than probably your needs, is the degree of security on the device. The iPad and iOS devices are the only sort of HIPAAs are sort of patient health privacy mandate. They're the only devices out there that are secure data right out of the box. So open this out of the box, it's HIPAA compliant. You put a passcode on it, it's even more compliant. Android and Samsung and all the other different manufacturers don't meet any of those data standards, and there's not yet a hardware secure non-iOS device. And so there's always that high liability of losing protected health information with a non-iOS device.
So to follow off of that, do you also consider them ADA compliant, and do you have any issues there with your students?
We have not yet with our students, none that have reported. We've been sort of looking at just, overuse syndromes and other items. Julie's been working with
an ophthalmologist. We're looking at eye strain to see if reading for a long period of time on a digital device will cause eye strain and headaches. Initially we had some reports of that, so we thought it was something to look into, but it could just be that medical students are very intense people when they read. Who knows? We're conducting the study now, and we have one more session. We should be completing our data collection, so we'll have results soon.
Yeah,
Have
but
the studies also been done there just on reading regular textbooks?
Well, so we were looking into that space because as part of this study, so we were interested from a clinical perspective of whether the digital device induces eye strain, but at the same time, we're having them read. So we're doing a pre and post to see if, and we have a comparison group with students reading a hard copy text, and we want to see if there's difference in their recall after they've read for they read for an hour. After they've read for an hour, is there a difference in the recall? I think there's been some research earlier that has said that because of the way that your spatial cognition works when you're reading in hard copy, so you can sort of picture the page, where things are laid out when you turn them, you can kind of remember this was on the end of that page and at the top of this page, that sort of spatial cognition helps and influences your recall and comprehension. And so, we'd like to see if we will see the same findings or if it'll be different.
That's short-term recall. What about long-term recall?
Right.
Hard to know.
Yeah, it was hard getting the medical students in for that hour to sit with us.
But it's true, because a lot of the digital textbooks, they've really gone away from, there's some things on iOS, like the address book looks like an old address book, or the calendar looks like an old calendar, and Apple gets all sorts of grief about that as a design issue. But a lot of the digital textbooks don't have pages anymore, it's just one long continuous scroll. And so I remember for myself, going through tests, I don't know what the answer is. I can tell you what page it's on and where it is and what color I highlighted it in, but I have no idea. And so those pieces you sort of lose in a completely digital environment, and we don't know what that outcome is going to be yet. So.
Can I go back? So you had a course and you had a lab manual that you converted to NIBOOK, and you said it was pretty easy. How many man hours of work?
No, it wasn't that easy. There was a lot of work.
So this lab manual is like for how long is a lab manual?
Okay.
And how many man hours?
It's about 80 pages long in terms of if it was a print, And I would say Jonathan put in at least 60 hours to make it. It was a lot of work for him. And back and forth. I also needed to improve my images. That was an issue where I needed to go back, be sure I had the copyright, and put in the images. So, and I think it's getting easier now, to manipulate the software. But it's a definite time commitment to do that. And I'll finish up because Julie has interesting things to say too. But I just, for us scientists in the room, I thought that was useful. We always see these diagrams, but what does it really look like? And then something that I felt was important to do is, if we're digital, then we're digital, is this is how I link to EEE. And because micro is so visual, we just put links into the book. I use Survey because I had 100 students and I wasn't really grading them per se. I just wanted to be sure they were doing the work. But the nice link to EEE gave me more visual. My job is to be sure the students can recognize these images when they're taking the USMLE. So you could link to quiz if you wanted, if you only had 20 students. So this was custom made, and it's a very useful thing to do, I think, for your students. Real quick, I want to say we also have iPads in the anatomy lab. And because anatomy is a very messy lab, I actually put them in Ziploc bags, and it does work. I always get that question, does it work? And what we're doing for student learning now is we started with 12 iPads in the anatomy lab. And the first year, I don't know, it was okay, but not great. The second year, the students started to fight over the iPads, and then this year it got even more exciting. And so now we have 20, one per group, because yes, we want the students to interact with the iPad. And so now with these anatomy iPads, the students in their groups are actually asked to teach each other. So in our lab we have 20, which is a bit to manage, but 20 iPads, 20 groups, 20 cadavers, and then the students teach each other. And one nice thing, if your lab is working that way, is on the anatomy iPad we have, and the students have it as well, is we have a video atlas. So the students can be in the lab, and maybe they're dissecting the heart, and I don't want that one, I want this one. They can look at the real heart, in their hands, and also have this video to help point out what they're supposed to look at. And there's narration.
This is the right atrium.
One more thing that's useful with the iPad, I wanted to mention this since we're here at UCI, is Fuse is an app that works with UCI Replay. And so you could think, if maybe your students don't have an iPad, but you do, you could film things with Fuse, maybe a lab experiment in your own lab, or if you're at a musical performance, or even have the students film each other and evaluate each other. So that's a very useful, I don't have it on this iPad, but my own. Fuse is very useful. And we have basement study rooms, and we want the students to work with each other. And so in our basement, we have 10 classrooms with 10 monitors, and these are available for the students to hook up their iPads, sit in a room, and show each other what they're working on with their iPad and go through reviews. So I'll stop there and let Julie talk.
So I actually, since we're sort of running low on time, I'm going to try to go through. So I work with the 3rd and 4th years on the clinical side, and if you recall from when Dee presented our backgrounds, I'm probably the only person on the team. I don't have a clinical background or a basic sciences background. So coming to a medical school and working for me was a really new and interesting experience. And all the things that, I had studied in school about education and pedagogy, a lot of those things sort of go out the window when you're in the clinical setting, because they're teaching in an environment that at least for me, was very unfamiliar. They're not in a lecture hall. This is cognitive apprenticeship on steroids, right? Their students following, you know, residents and attending physicians around, working with real patients, learning as they're working. And so some of the things, and I also was thinking about these, since I am going last, had more time to think about some of these questions that you had, so I'll try to incorporate them or, you know, feel free to chime in. But what I'd also like to demonstrate is that, so there's you have the iPads, and if you have an iPad, there's the adapters that you can hook in, you know, VGA project. But there's also this tool called Reflector, which allows me to AirPlay to, are we on?
Should be. You might have to
okay.
try the connection one more time.
Okay, so it allows me to AirPlay to, oh, it disappeared.
There you go.
It allows me to AirPlay to a computer. So this is a way that we're able to make podcasts, because it's difficult, right? To sort of, if you want to demo something that's on the iPad and capture it, it's hard. So an app like Reflector allows us to connect to a laptop and share from the laptop screen, so you can capture for podcasting, which is neat.
That's why. Sorry.
Okay.
I figured it out.
So when he starts the Reflector app, then it sort of acts as if it were a station that I can connect to. And so now it's over the local network. Oh, it just disappeared.
There you go. Should be back now.
May not work.
So it's working in here.
No. It's much more set up for an environment where you can go directly from one device to another, and here the routing goes back through and is filtered to prevent that type of thing.
That's right. So it works well for me at home. I know that's there.
And
So
it works well for me outside of the lecture room.
Right.
Right.
Well,
But
we've-
we're lucky in here because we have our own wireless network that we're able
Right.
to connect on. So that's
And for our small group rooms, you know, we're experimenting right now with setting up our own mini network in each room, just so you can interconnect, and then using either Apple TVs so that you can all sit around like this, not plugged in. And what happens is an Apple TV just takes the most recent request. So one person can show something, one person can disagree and push their screen to the TV. Someone else could override that with their image. So you can have sort of a rapid fire, you know, who's got the right image for this discussion. And so we've been doing a couple of experiments. For us, it's a lot of fun toys to play with. But as Stephen mentioned, the wireless issue has been a problem. But you know, just creating a small separate little network there makes it more feasible. So.
right. So now this is my iPad projecting onto Warren's laptop. So one of the first things I wanted to talk about was iTunes U. One of the lessons learned that having done this a few times with the medical students was that it's really important for us to have an orientation with the students. Initially, it was an hour-long orientation at the beginning of the year. We graduated to, you know, being allotted a morning on a Saturday, and last year we actually had a day and a half with them. So even though most of the students are tech savvy, just being able to get into the sort of the getting a workflow with the iPad, learning about the different apps that are available, and you know, seeing how it could integrate into their academic life was something that, you know, even for the experienced student was useful. And one of the ways in which we were able to share this information was through iTunes U. So we have several courses that we've created. One of them, so for our third years, we have this iPads in the Clerkship, which anyone is able to go into the iTunes U store and download. But if you haven't seen iTunes U or a course in there, you know, it's nice because you can put all your posts in there, so we can upload information, orientation materials that we want to give to our students. So, or if you have a course, you can organize, you know, the different the different sections by, say, weeks, and you can upload course materials there. For us, it's also nice because all the iPad apps that we've recommended or required for the different clerkships can also be in there, and they can go directly from here to the App Store and find them without us having to, you know, post links anymore. So it's nice. The other nice thing is that again, because we're in a clinical environment, our students they're no longer all together, the 104 students are no longer all together in a lecture room. They're spread everywhere, they're on different services, they're in different hospitals even. So, we have students that are at the VA, for example. So we do use a combination for learning management system, we use a combination of SharePoint plus EEE for some of the features that we don't get there. But that's not always effective if you don't have a wireless connection. So even if we had a Blackboard or a Moodle, which would be great, we can't be sure that our students in the clinical years are able to access the materials. So with the iTunes U course, they subscribe, the material gets downloaded. When they're back online, if there's new material that gets posted to the course, they'll see the notification and they can get the update then. But in the meantime, they have the material available to them. So that's been a nice feature for us. May not be applicable at the undergraduate level, but say you have courses that have field work or where they're not necessarily in an area where they have Wi-Fi. iTunes U is useful for that.
And the timing for these is actually much better than the iBooks. Creating an iBooks, it takes a lot less time. For each one of those courses we put together, it probably took about maybe 2 to 3 hours to compile all the content and load it in there. And it's a pretty easy web interface to do so. But the nice part with those courses, you can push up iBooks into that, videos, other items to make that work. And it gives you some basic stats as far as how many people are subscribed to the course. And so just to give a quick example, as I'll kind of take over the screen for 1 second, this is sort of the roster list of what we have so far. And so the bottom 4 are more frequent courses. The largest 2 are our emergency medicine iPad programs. We built an iTunes course for our ER residents so they can learn what apps are useful in a clinical setting. We have 18 residents in our program and 14 faculty, or 20 full-time faculty. 20 full-time faculty, but we shared this course publicly, and there's now 2,200 or 1,900 downloads of that course, and there are now 1,900 individuals across the U.S. or beyond that are subscribing to the same content that we feel is appropriate for emergency medicine residents or doctors to use in that environment. Our health elective courses there, and even just how to use our iPad clinically. That course has around 600 subscribers as well. So if it's not just our students that are getting the content, it's other students as well. And so if you have good things to share, it's sort of great because your reach is now much broader than what you probably had before with a very simple mechanism. So.
And, just to address the question, which is a very valid question, that, is the iPad still the right answer? I think for us, there's no question about it. It might be different, for other individuals. And although we started with the iPads in the basic science curriculum, we say the first couple of years, that was actually the most challenging. There is no question now that the students are in the clinical years, there's no other device even in the realm. So all of our medical apps, all the content that is non-textbook based, which is a whole world out there, is now, there's no question, iPad is that environment for them. And it might not be for other situations, but I just want to kind of point out that the benefits we got in the first 2 years are on just several-fold bigger now that they're in the clinical years. I mean, there's no question about it. Our electronic medical records is only on the iPad. Everything else is only that way because of HIPAA and other reasons, but that's just one of the reasons. But all the apps that you mentioned, they're mainly, the iPads are by far the most available format. They might be on other formats as well.
Right.
Go ahead.
Oh, I was just going to add that, I know that there are different camps of thought on being device agnostic or going with a particular, OS. I think, and I think there are pros and cons to each. I think in our case, we've taken advantage of it. And, being able to have something like an iTunes U platform, which we might not have had somewhere else, has benefited us. Being able to have iBooks, and the tool, the iBooks author tool, that allows you to the question came up, how long does it take to create an iBook? Using iBooks author, technically, it's not the time to learn it that's hard. If you're familiar with Keynote, you could probably pick up iBooks author fairly quickly. I mean, the time is still spent as you would creating any textbook, and that's getting the content in there and getting high quality images, and so the technical part of it is very easy to overcome, and that allows us. And I just wanted to show another example. So Mary Frances showed an example of faculty use of iBooks author to create an iBook. Our own medical students create this medical student survival guide. So this is, if you look at the author list, it's about 25 editions of this. So for 25 years, they've been compiling tips that they can use when they go on their clinical rotations. And, in previous years, they used to get a little hard copy. This year, we put it in PDF initially because we didn't have the time to put it into an iBook. But now it's available in iBook, so they can go on any rotation. They can go and say, how do I do, do a patient history and physical, and I can come to that chapter and I can quickly scroll through, and the students have already weeded out what they know are the important things that they need for that rotation, and they have this information at their fingertips.
I just wanted to make kind of a comment and a question, and you haven't spoken very much about social media, computer-mediated interaction. I mean, that's something that probably takes place a lot via laptops or smartphones, so the iPad, may or may not change that equation much. Kind of a comment that might be useful to some people in the room is there's a social media platform called Piazza.com, and I don't know if people here are using it, but I know a lot of the faculty at UCI are using it. It's kind of a social media, a homework social media site where students can pose a question and kind of crowdsource the answer. The rest of the students can collectively respond to it, and the faculty can respond to it, and a lot of faculty have found that really cuts back on time in responding to student questions and things.
Right.
So that was just, and I know they have an iOS app, an iPad app.
Right.
But I was just wondering if, sort of student interaction is just something that was going on before on laptops and smartphones, and is still going on as it was before. Are there particular ways that you found that the iPads are sparking more sharing of ideas and communication?
Like the textbooks, the Inkling textbooks have the social networking features, and I think the other textbook providers are sort of including that. In that case, the students haven't been sharing as much socially. The concept is neat. You can go in, you can share notes with a group of, I think it shares with everybody right now. It shares to the public. If a faculty member were to go on and highlight the important parts of the chapter that were important, and students could get and share those notes, I think it'd be a really neat way to read through a textbook. Our students didn't seem as willing to do that, but it's not that they're, sort of opposed to social media. They're definitely active.
It's odd though. I think our student percentage, when we look at just overall compared to say other campuses or just other overall usage, their usage of social media, especially Twitter, is probably in single-digit percentages. Facebook is more of a passive item that they aren't really even that involved in, which is kind of surprising. But their overall just usage of discussion forums and other items is not as robust as we've seen in other literature and just other anecdotes from other campuses or even just undergraduate research. And so we've been trying to come up with alternative ways for faculty to use the technology to make it more able for them to participate. We have some faculty that are based clinically in the hospitals. We've talked about having them create short, 20-minute focused podcasts that would alleviate the need for them to drive down against traffic from Orange down to campus, and having, virtual office hours with a discussion forum where they can do that from the hospital setting and not have to drive in specifically for those purposes. But those have been, one-off experiments that, while promising, haven't been replicated very often or very well. But the overall response from faculty was, this is great because now I can still teach and not have to spend 2 hours in the car just to get to Orange from here. And so we want to try more things like that, and I think we just need a couple more champions from the faculty side to really say we want to be the virtual office hours people.
I just wanted to mention that we have a handout back here that has some of the resources that have been referred to, like Prezi and Piazza, and how to get them and what they can be used for.
Great.
So if you're interested, it's right back here where it says about clickers, but it's not really about clickers.
Great.
And the social media it's interesting, our students do study a lot together. We have these basement rooms that will be full of students, talking to each other. So maybe that's good. One-on-one or, in group settings, they do study a lot together.
Okay, so I just wanted to highlight, there's so many apps that our students are using in a clinical setting, and we're really lucky that in this space, there are a lot of iOS apps. DrawMD is an app that we encourage and we actually use in family medicine. The students are encouraged to use this when they have the chance with their patients. And it's a tool that allows you to sort of have a conversation, and it might lead to, for us, for the medical students, it's active and interactive learning. So they have, DrawMD gives you a library of medical background images, so that, if you need to talk about a treatment plan or a condition or a disease that a patient has, you have something to talk with. So it's not, you don't have to draw diagrams, you don't have to,
And we're not very good drawers.
And so if I pick this image, what's neat about it is it gives you a list of stamps that are relevant to a particular specialty or the image that you've chosen. So in this case, if I want to talk to someone about a heart condition, I can put on the stamp for a cross-section of a heart. And if, say, this patient needs a pacemaker, I can put in a pacemaker. I can make these larger and smaller. So, if a patient had cancer and there was a tumor, you could, approximate the size and the location of the tumor, and then, you can annotate on here. And
So this is what I'm talking about when when I was telling, this is what it's all about for the students at the bedside with the patient.
And then I was trying to think, we were talking about how can you encourage more interactivity and how could it be used in lectures? So if you were in an undergraduate setting, what's nice again about having everyone on the same platform is that there are tools, like there's interactive whiteboard tools, like SyncSpace. There's many of these. This is actually free. But if I am a lecturer and I, want to write a note, or if I'm teaching math and I need to explain a math problem to a student, I can do this. But I can also, why don't I pick that up? I can also, as a student, get onto the same whiteboard. So if we're on Wi-Fi, I can get access to the same whiteboard. And so say if we were in a medical setting, I could pull in an image and draw on this.
What's that whiteboard at?
This is called SyncSpace, but there are several of them. This one's nice because you don't have to be on the same subnet. It links through a URL so that you can be sure that your students will be able to get on, even if you're in a lecture hall and your subnets are not the way you'd expect them to be. So there are apps like this that allow interactivity and use in lecture or small groups for our medical students, when they're in rounding teams and they're going out with, they could be anywhere in the hospital, but there's so many opportunities for it. So I went on my first rounds in neurology last week, and there was a moment where the resident got paged and had to take a phone call. So the attending was with the two medical students, and instead of just sort of, spending time in the hallway waiting around doing nothing, she took the opportunity to teach. So it was 4 things about the brain that I didn't pick up on. But if she had an iPad, and our attendings don't all have iPads yet, but our students do, it would have been a great opportunity for her to pull that up and say, here's an image, and here's the brain, and here are the 4 things that you need to know. The iPad for our students in the clinical setting has been really great because, as Shahram has talked about, EMR has been having EMR access to the electronic medical records on their iPads has been really sort of a critical change that's happened for our third-year students. I think typically they were probably just sort of following their teams around and sort of ignore, but now they're the people on the team that the attendings point to and say, hey, can you pull up this lab result? Can you pull up this record? Can you find the room that we're going to next? Was a question that I heard while we were rounding. And so they've become more a central part of the team, and I think academically it becomes a more engaging experience for them as well. And then, you know, faculty development is hard. So unlike here on campus where we know our faculty are here, the clinical faculty are all over the place. And again, they're also at, you know, different hospitals, different locations, they have different schedules. So, we've been fortunate that Sharam, who's our associate dean, has given us, our team, time during the monthly meeting where all the clinical course directors get together to have a showcase, technology showcase. Initially it was iPad, but really, I mean, focusing on the iPad goes beyond just the iPad as a device. I mean, there are apps that we could show every month, but just being able to use it outside, use technology in general in the clinical setting. So we have showcases. For example, in December we did audience response systems because now we can use the iPad as a web clicker. We talked about etiquette with, how do you use a mobile device when you're with a patient? So what are the things you need to think about? Online quizzes. So again, because they're in a situation where they're mobile, being able to take online quizzes, because they're not, you can't be sure that you'll have all your students in the same place at the same time is pretty, it's a pretty nice feature for them to have. And so we've had this opportunity to showcase to our faculty different things that they can do. And then finally, as Warren had mentioned, we really rely on and appreciate the input from our students. So we developed a rubric, again, because evaluating apps is sort of all over the board. Sometimes you get reviews that focus on one feature of an app that somebody likes, and that's all they write about. We wanted to get our students to be a little more technology literate and think about different things like, what is the navigation like in the app? Because if the navigation is not good, when they're in a moment with a patient and they can't navigate through the app, well, that app's not really useful to them, even if it has great content. So we're trying to get them to think about different aspects of reviewing an app. So we created this rubric, and this is one that a student has done. So they consider navigation, the UI, the content, the accuracy, which is really important for medical apps. Is that is the content accurate? Is there security? And getting the students to review these apps helps us go through that huge landscape of the medical apps that are out there, so we can focus in on the ones that are really useful for use in our program.
Great. Well, thank you. I know we ran a few minutes over, or a minute or two over. We're more than happy to hang out here afterwards for some of the specific questions. It's sort of a lot of ground to cover, so I appreciate everyone staying with us here to the end. But I'll share our contact information with Dee if there's specific questions you want to follow up with us too.
I was wondering also if you would be willing to maybe, if we posted some of these
Yes.
topics that people were interested
Yes.
in, maybe have you do a few bullet points on each, and then we could send your responses to
Absolutely.
everyone.
Absolutely.
And
We'd be
that
happy.
way we make sure that at least each of your issues gets addressed to some extent, because this is probably a topic we could talk about for days.
Yes. Yes. No, absolutely. We'll do that.
Thank you very much.